Top 5 vitamins people with hypothyroidism should use. Hypothyroidism, a condition characterized by an underactive thyroid gland that fails to produce or release enough hormones, can lead to a range of troubling symptoms. These include a slowed metabolism, weight gain, heightened sensitivity to cold, hair loss, and numerous other issues. So, what exactly happens in your body when hypothyroidism sets in? As illustrated in the accompanying image, the thyroid gland, shaped like a butterfly, resides in your neck, just in front of your windpipe. This small gland plays a crucial role in producing hormones that regulate various aspects of your metabolism, including digestion, heart rate, breathing, body temperature, bone health, and much more. When your thyroid malfunctions, either by producing too few hormones or none at all, a host of problems can arise. These include hair thinning, especially at the outer edges of your eyebrows, an intolerance to cold temperatures, and overall weight gain. You may also experience persistent fatigue and feelings of depression. Some individuals may notice the development of deep, vertical ridges on their nails. Left untreated, an underactive thyroid can progress to the formation of nodules and goiters, which manifest as lumps in the neck. In the worst-case scenario, untreated hypothyroidism can lead to life-threatening conditions as your body's internal organs slow down and lose their proper function. But why does the thyroid cease to function correctly? Research indicates that 90% of cases of hypothyroidism are due to Hashimoto's disease, an autoimmune disorder in which the immune system mistakenly attacks healthy thyroid tissue. This autoimmune response often originates from damage to the lining of the gut, allowing undigested proteins like gluten to enter the bloodstream. This triggers inflammation and an overactive immune response that mistakenly targets the thyroid as a threat, resulting in damage and inflammation within the gland itself. Another possible cause of hypothyroidism is inadequate liver function in filtering out toxins or a deficiency of essential nutrients in your diet, such as selenium or iodine. Today, we will delve into 5 vitamins, used broadly to include minerals and nutritional supplements, that can aid in the restoration of your thyroid gland and the re-establishment of a healthy hormone balance. Furthermore, we will explore simple lifestyle adjustments that address the underlying causes of thyroid issues. It is essential to note that when we refer to vitamins, we are encompassing minerals and dietary supplements that can help mend your thyroid gland. To begin, let's address the first item on my list, which is of utmost importance: selenium. If you choose to, you can incorporate a daily supplement containing either 200 micrograms of selenomethionine or selenocysteine to enhance the well-being of your thyroid gland. Selenium stands as one of the vital trace minerals required for converting the inactive thyroid hormone, T3, into its active form known as T4. In essence, supplementing with selenium can expedite this conversion process, particularly for those with a sluggish thyroid. Research also indicates that selenium intake can decrease thyroid antibodies, thus mitigating the risk of your immune system launching attacks on the thyroid, which can lead to further complications. It's noteworthy that women, in particular, are 8 times more likely to suffer from hypothyroidism compared to men. This heightened risk, especially after pregnancy, often arises due to hormonal imbalances stemming from elevated or reduced estrogen levels. However, selenium can assist in rebalancing these hormones by promoting liver health and bolstering the body's antioxidant defense, including the vital glutathione. Now, moving on to the second supplement on my list: bile salts. Surprisingly, many are unaware that a significant 80% of thyroid hormone conversion occurs within the liver rather than the thyroid gland itself. Therefore, simply relying on thyroid medication may not address the root cause, which could originate from liver or gallbladder issues. These issues might include a fatty liver, gallbladder stones, or the accumulation of toxins like mercury in the body, all of which can trigger inflammation and hinder thyroid hormone conversion. If you're interested in improving your liver health, consider supplementing with bile salts. You can take 2 capsules before each meal of the day. This helps to thin out the bile in your liver, facilitating the conversion of T4 to T3, while also aiding in the detoxification of toxins such as mercury, other heavy metals, and harmful chemicals present in your diet that may irritate your thyroid gland. Number 3. Vitamin C complex. As discussed earlier, a staggering 90% of thyroid cases are attributed to Hashimoto's disease, an autoimmune condition where the immune system mistakenly attacks the body due to excessive activity. This often arises from damage to the gut lining caused by the consumption of grain-based foods like bread, pizza, popcorn, cereal, biscuits, cakes, and pasta, which contain the protein gluten. Gluten damages the intestinal lining, creating tiny openings that allow toxins and undigested food particles to enter the bloodstream. As the immune system doesn't recognize these foreign substances, it launches attacks throughout the body, leading to inflammation and various health issues. Interestingly, the thyroid tissues share a similar protein structure with gluten, prompting the body to target the thyroid gland as if it were an invading pathogen or virus. This is where vitamin C becomes indispensable. A genuine vitamin C complex includes bioflavonoids that promote collagen production in the body and aid in the healing of the gut lining. For an added boost, you can incorporate 1,000 milligrams of vitamin C through sources like acerola cherry capsules or powdered fruit blends into your daily regimen. However, be cautious when selecting vitamin C supplements, as those containing only ascorbic acid, which represents a mere 5% of the complete vitamin C complex, may not be as effective. To truly heal your gut, it's advisable to obtain the entire vitamin C complex from foods like cabbage, sauerkraut, strawberries, bell peppers, and cruciferous vegetables. Number 4. Iodine and zinc. Trace minerals are indispensable nutrients that our bodies require in minute quantities, yet they play a pivotal role in catalyzing thousands of chemical reactions by supporting various enzymes. Previously, we emphasized the importance of selenium in thyroid health, as it aids in neutralizing free radicals produced during thyroid hormone synthesis, thus reducing inflammation and enhancing conversion. In addition to selenium, zinc is another critical mineral that facilitates the synthesis of new thyroid hormones. Iodine, on the other hand, serves as a fundamental component for the production of T3 and T4, the primary thyroid hormones. To incorporate more of these minerals into your diet, consider adding seafood options such as sea kelp, nori, kombu, Irish moss, mussels, clams, crab meat, and oily fish to your meals 2 to 3 times a week. Alternatively, you can opt for liquid trace mineral drops mixed with water, or sea kelp capsules to supplement your trace mineral intake. These minerals not only support thyroid function but also contribute to healthy skin, hair, eyes, and nails by aiding in the regulation of cell growth. Number 5. Vitamin D3. Consider a daily intake of 10,000 international units of vitamin D3, along with 100 micrograms of vitamin K2. These vitamins play a crucial role in hormone balance and reducing inflammation in the thyroid gland. Vitamin D, in particular, acts as a hormone that modulates and regulates the immune system, preventing it from mistakenly targeting the thyroid. Research indicates that individuals with hypothyroidism often have insufficient vitamin D levels, usually due to limited sun exposure or inadequate endogenous production. Higher doses of vitamin D3 are frequently employed by functional medicine practitioners to address autoimmune conditions like Hashimoto's. Furthermore, vitamin D enhances liver function, promoting hormonal equilibrium and detoxification, which can mitigate inflammation in the thyroid. Before making any dietary or medication adjustments, it is imperative to consult your doctor regarding the use of these natural remedies. If you suspect you have an underactive thyroid and seek a definitive diagnosis, there are at-home blood tests available for your convenience. Now that we've explored various nutritional supplements for managing hypothyroidism and discussed testing options, let's delve into the underlying causes of this condition. As previously mentioned, excessive consumption of gluten or grain-based foods can harm the gut lining, triggering an autoimmune response in the thyroid. Another contributing factor is the overconsumption of deep-fried foods and inflammatory vegetable oils, which can damage the intestines and liver, leading to inflammation and toxin accumulation within the body. It's worth noting that approximately 80% of thyroid hormone conversion occurs within the liver. Thus, liver disease, especially in individuals who are overweight, can impede thyroid function. Prolonged mental stress, overtraining, or the onset of menopause can elevate cortisol levels excessively, signaling the thyroid to produce fewer hormones. Additionally, insufficient dietary intake of iodine and selenium from wholesome sources may hinder thyroid hormone synthesis. Certain medications, such as statins, diuretics, antibiotics, and blood pressure medications, can induce hormonal changes that weaken thyroid function. Now that you're aware of these factors, let's delve into 6 lifestyle tips aimed at enhancing the well-being and functionality of your thyroid. 1. Eliminate grains, vegetable oils, and gluten from your diet completely. This includes foods like bread, popcorn, canola and soybean oils, corn oils, biscuits, pasta, tortillas, rice, and more. Maintain this dietary adjustment for a minimum of 90 days. You can aid in the restoration of your gut lining by incorporating bone broth, raw garlic, kefir, sauerkraut, and low-glycemic berries into your diet. 2. Incorporate anti-inflammatory organic foods such as steamed broccoli, cauliflower, leafy greens, radishes, celery, and Brazil nuts into your meals. Include pasture-raised eggs, wild-caught salmon, sardines, grass-fed beef, organic pork, and shellfish rich in trace minerals. 3. Avoid adopting a low-fat diet, as your body requires specific fats for hormone production. Sources like virgin cod liver oil, pasture-raised egg yolks, and grass-fed butter are excellent providers of retinol, a compound that assists in activating specific thyroid receptors. 4. If you find yourself under significant mental stress and experience tension, consider taking ashwagandha capsules and enjoying lemon balm tea. These natural, ancient adaptogenic herbs can help reduce cortisol levels, alleviate stress, and balance estrogen levels, which could be contributing to hormonal imbalances. 5. Consider incorporating some of the supplements mentioned in today's video, particularly those containing bile salts, to enhance the conversion of T3 to T4 within your liver. Seek out supplements that contain bile acid factors, bile salts, ox bile, or TUDCA. These substances can aid in detoxifying the liver and intestines by eliminating toxins and undigested proteins. 6. Last but not least, adopt timed eating habits. Consume all your daily calories within a 6-hour window, allowing your body 18 hours of fasting. You can still consume the same quantity of calories as you would throughout the day, but confine your eating to this specific time frame. This practice triggers autophagy, which can reduce inflammation, regulate an overactive immune system, and prevent further thyroid complications. To learn more about this topic, please like the video and subscribe to my Healthy Care channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy.